Good morning, good afternoon, good evening. This is Nurse Nelly, a Kenya registered community health nurse, what we call here in Kenya, KRCHN. If you have noticed all over the world, nursing is in different categories. For instance, in Kenya, you can be a registered nurse, at the same time, you are a community nurse, at the same time, you've done midwifery. But if you go to the outside world, you will understand if you are a nurse, it must be you are a general nurse, or you are a psychiatric nurse, or you are a midwife. You must be having your certain line of work. But here in Kenya, we call it KRCHM. You are a community nurse, you are a midwife, you are general nursing. It's basically that. But still, there are some institutions that train what we call the RN, like the Nairobi Hospital. They train Kenya registered nurse. So today, I'm here to welcome you to my YouTube channel and to introduce my company, the Nelrobert Homecare Solutions. What do you do in this company? In this company, one, I train caregivers. You'd like really to know, because in Kenya, people have not really embraced caregiving. Watu hawajakubali. They can take care of the sick. They can take care of the elderly, people with dementia, people with chronic ailment. Watu hawajakubali, you can take these people at home and stay with them at home and give them the normal or the basic care that they are given in hospitals. So I'm really trying hard to introduce caregiving to you people, caregiving training. I'm doing both caregiving training and caregiving services. I, as Nelrobert. So here in Kenya, as I've said, that people have not really much gone into keeping patients back at home, stay with patients at home to the environment that they are used to, and as well to be taken care of the people by the people that they are used to. So I'm introducing caregiving for people to be able to know, for people to train first, and for people to know that you can stay with your patient at home receiving the same care that is given in hospitals. I'm here for you, and I'm training both female and male. This course in Nelrobert Homecare Solution has no qualifications. The reason as to why I say this is I've been receiving people at the ages of 60, at the ages of 65. Somebody just wants to learn basic nursing care, because they could be caring for their grandmother, they could be caring for their grandfather who is just elderly, and probably they just want to know how to take blood sugar, how to take BP, that is a blood pressure. Basically, they just want to know how to, they just want to learn how to take vital signs. So if I say that I'm going to limit people in terms of age, then I'll be unfair to you people. Because if you go to the US, you go to the UK, and those people who are traveling from this country to those countries, you know very well that the only job that you can work as you sort your immigration status is caregiving. You can't go and work anywhere else apart from nursing homes before you sort out your immigration status. So those people traveling, you are going for visiting. Your mom is here, she is traveling to the UK, to the US, to Australia, to Canada, and maybe probably she's just coming to say hi to you, to visit you, and you know your family is there. Again, let your mom, let your sister, let your brother just come to Nelrobert and do basic caregiving training. This is the only job you can work outside country before you sort out your immigration status. So I'm here welcoming you for caregiving training, and as well I look for jobs for these people that I'm training, because I'm as well doing the caregiving services. So anytime I get a client, anytime I get a client for caregiving, I first consider that the people that I've trained, probably the ones that have finished, or the ones that have gone for attachment in hospitals. So Kenyans and everybody at large, I'm very sure you've heard about caregiving, but you don't know exactly what is this caregiving. We are doing caregiving for a very short period, that is 6 months, and our period is entitled by theory training in class and partly practicals in class. And then when you go now to the hospital, or for attachment as we call it back here in Kenya, you undergo your clinical experience in the hospitals. Age limit, I've said, I don't want to say age limit, but at least be from 21 years and above. If you want to travel to countries like the Gulf, we have a very big demand for people traveling to Gulf for caregiving. And this is the time for you guys to train caregiving. As you know that, I don't want to take much, but you know there's war in Iran, in Iraq, in Saudi Arabia, in Dubai, and Jerusalem, and all those countries. You are in the media and you know exactly what is happening. Remember, these countries, at the end of the day, when things settle down, they will be in need of caregivers, they will be in need of house managers to go and take care of the people who will be wounded during the war that is ongoing. So I'm telling you people, I'm encouraging you people, parents back at home, maybe uko na watoto huko walimaliza form 4, they have done other courses and they are not able to get jobs here in Kenya. Caregiving is the way to go, people. Come, train caregiving, and as much as we won't promise you, all of you 100% to get jobs outside, you can be sure that your son or your daughter will be able to get jobs here locally. Even if it's caregiving in homes, caregiving in people homes, they are due to our connection between the training and the caregiving services, you can be sure that your son or daughter will get a placement of somewhere to earn a living. So thank you very much, and from now expect many videos, expect many notifications on jobs availability in caregiving, and as well as training. For the next intake for caregiving training, we are in the month of March, so the next intake will be from April 3rd to 5th of April. So if you are planning to join, you can call us, you can email us, and we'll be able to respond to you. So welcome everybody. It's our first video in YouTube. So subscribe, as many as you, those who have trained before, those who have offered jobs before. You are welcome to comment, you are welcome to give your reviews, and we are here for you to assist. Those with patients back at home, please, Kenyans, stop keeping your patients in hospitals. It's very expensive for you to keep a patient in hospital for something that is manageable from home. Please consult me on free consultation and free visits to your patients in whichever hospital in the country, because we need to save. And also we need to give job opportunities to for the caregivers that have finished training, or the ones that are in attachments. So Kenyans and everybody as a whole, let's embrace caregiving. Tutafute caregivers, because some of the things we are spending millions and millions of money in the hospital, you only need 1 or 2 caregivers to stay in your home and take care of your parents. Wale watu mko ng'ambo, and you have left your parents behind here in Kenya, wako hapa. Sometimes these patients, your parents are just lonely. So get a caregiver for them. A caregiver will be able to check their blood pressures at home. A caregiver will be able to check their sugars at home. A caregiver will just assist them in their daily living. A caregiver will just go and drive them for shopping and necessary necessities and bring them back home. At least a caregiver, anytime you can't reach your mom or your father at home, she's there for you to assist and just to tell them wanaendelea aje, how is it going, what is happening back at home. So let's take care of our parents, wale wako nyumbani, and those kids that are living very far away from your parents. The best people you can entrust with your parents back home are caregivers. Yeah, so thank you very much. And parents, before I forget, if you get children or you have children who have planned to take care of you, kubali, accept to be taken care of, because at the end of the day you are aging and you need people to remind you how to take your medicine, how to go for your checkups, how to go for your for your visits and doctor's visits and other medical related issues. So thank you very much. Let's embrace caregiving and let's join Nelroberts Training and Home Care Solution for caregiving. So thank you very much and subscribe to my YouTube channel.